Can you all see the screen?
Yes, ma'am.
Right.
Yes, ma'am.
Okay. So to those who actually joined newly, I'll just quickly give a recap of what we did last week. So the topic that I'm going to first do will be like principles of health and safety for health professions. So the topic is very, very direct. Basically, we just want to know what are the ways, like for a healthcare profession, what are the rules and regulation, what are the ways that you can make a healthcare sector better, right? So mostly the learning objective is like to understand what is legislative framework for health and safety in a health and social care setting. All this has been done in the very first lecture. We have so many legislative framework and legislative regulations that needs to be carried out for effective healthcare safety, right? So many things when you want to take care of corrosive or toxic chemicals, what are the legislation, right? So like lot of things we learned, around 15 or so regulations we learned. So you can watch the recording for that also. Just a brief recap I'm going through. And then how policies, procedures, and practices in own settings meet health and safety requirements. And then how to understand, support others to comply with health and safety requirements. So last week, I always mentioned the word compliance, meaning how you have to obey by a certain rules and regulations so that you will have an effective healthcare setup in the healthcare system. So that is basically about compliance, right? Anything, it doesn't need to be in a what do you call in a hospital only. Be it any place, you need to obey certain rules. That is the only way you can have a proper workflow in a healthcare setup, right? And then we need to understand the consequences of non-compliance. If you know the meaning of compliance, you will understand what you mean by non-compliance. Non-compliance means you don't follow the rules and regulation. That is when an issue can happen in a healthcare sector, hospital, laboratory, because if you don't follow the rules and regulations, so many issues can come. People could be at risk, the people who are working there, the people who are employed there. So those are the things that you need to know, terms, comply and non-compliance, right? And also to understand the importance of what is record keeping. So we studied about what is a medical record, what is a health record, how does these two differ. So I said last time, you cannot give certain information about yourself in a healthcare sector. Only a doctor will be able to know what your sickness is, what your health status is. But in a normal, say in a medical record, those are the things that can be there where a doctor has access. But in a healthcare record, usually the name, the age, all those things can be included and anyone can have access to that. So you need to know the difference between those two. So to the ones who actually didn't come last week, basically we started off the topic of what is risk management in healthcare. I told last week there could be like so many types of risk, right? Maybe because of say one COVID patient enter the hospital, it's a risk because due to one person, there could be many people now under susceptible to get the disease, right? So that is risk. Or like I said last time, if there's a construction going nearby a hospital, you need to have proper boards and signs so that a person passing that place will know, okay, there is danger ahead. So we need to always make the people who are working there to bring some awareness how to mitigate any risk. So any questions that you all have right up until now, I'm just quickly going through the slides. Risk management in healthcare, very, very straightforward term. Sanjiva, do you like to add anything because you're on risk management sector?
No, actually the risk management is same as the, I think the every field is the basic is the same. Monitoring, identifying, the analyzing and the mitigation is the same thing in this field also. So it's very clear, madam.
Okay, that's great. That's great. Okay. So today I will actually show you all some videos. So before that, I will just quickly recap again. And then, like I said before, why is risk assessment important? Because to ensure, this is the main thing, health and safety of your employees and customers. So it's not just the people who work there, but also the people who hire the employees also need to be at safe, right? The bosses, the doctors, the nurses, they need to be safe, and the people who work under them need to be safe. That is the main risk of importance of having a risk assessment, right? So because the OTHM, like I said before, it's a UK program. So we mentioned mostly the UK will conduct risk assessment, our legal requirement, as stated in the Health and Safety at Work Act. But you have to understand every country as per their healthcare management, will have their own act, will have their own regulations. So that is very important, right? So because OTHM, you all are learning under a UK degree program, we talk mostly about the UK regulations and so on. But Australia, they have their own act. America, European Union, like Switzerland and all, they have their own healthcare rules and regulation, right? So you can read a little bit more when you all do your assignments. I'm not sure what questions you will get, but it's if you understand this, you can understand anything. Okay, and this is very important. Like when do you perform a risk assessment, right? So a risk assessment is usually performed, like I said last week. This is very important. A new process or steps are introduced in the workflow. Like for example, like suddenly you run a lab, right? And when you run a lab, you don't usually carry out any experiments related to COVID, right? Because there was no pandemic, nothing like that happened. But suddenly a COVID pandemic happened. So now you have new workflow that is coming into your lab because COVID is a new thing. So what is a new thing that is happening? People need to wear protective equipments, right? PPE, personal protective equipments. They need to follow certain rules and regulation. Before they enter, they need to have the mask. They need to wash their hands. So that is a risk assessment, because they know if they don't follow those rules and regulation, the people around them or the people who are working with them can be under risk. So that is the introduction of a new workflow. And if they are making a change to the existing process. So for example, what do you mean by change? A change is made to the existing process means, like for example, let's say that in the lab or in the healthcare sector, we don't use before what you call carcinogenic chemicals. Those days we didn't have any experiments to carry out where we need to use carcinogenic experiment, but now we are using. So because a new chemical is now existing, we need to follow certain rules and regulations, so to protect the people who are working and also to protect the other people from getting exposed to these toxic substances. Right? It's the same thing. Equipments, tools, everything are actually going to be a reason why you perform a risk assessment. So just remember these three points. Okay. I'm actually recapping because today's lecture is also a continuation of this. Okay, so it's not a loss for you guys. And this is just between what is a risk assessment and a job safety analysis. So a job safety means, like, with your own job, do you have a safety? Like I said an example last time, the person you are working with, are you having any problem? Is that person abusing you physically or verbally? That is your job safety. Or for example, you can keep your safety belongings and you can come back to see your things are still safe. That is basically a job safety. But a job hazard is many people in that workplace is having a issue, right? For example, again, COVID. One employee catches COVID, so it's a risk that the people around who are working in that place can have that issue, right? So you need to know how a job safety and a job hazard analysis differs. Any questions, students, right up until now? Y'all can challenge me, students. Y'all can ask questions. Y'all can differ with me, no problem. I'm not a strict person and I'm open to anything. Yes, somebody had something, I think. Anybody has question, students? Hi, Fayaz. Good to see you. I think we didn't see you last week. I can see the names now. And okay, so Fayaz, do you have any questions? Because I think last week you missed the lesson. So I'm just going through the lesson again quickly as a recap.
Yeah, sorry. Actually, I just joined. I'll ask you in.
No problem. Were you able to go through the last week's lecture files?
No, actually, I didn't had time because for last 5 days I was in the fuel queue. That's why I couldn't come to the online.
Yeah, I understand. No problem. So that's what I think maybe it's good that I'm going through a little bit with the lesson today. And I think, wait a second, Lahiru, are you new to the class? Lahiru, and I'm not sure. Okay. Anyways, so This is what we learned last week. So just know what is job safety analysis and a job hazard analysis. Okay, let's go. All right. So last week we also studied about main 4 types of risk assessment, that is health and safety risk, workplace risk, fall risk, and construction risk. So these are more or less a same idea, but it also have a different meaning. So the word health and safety means like anything regarding to your health and your safety. It could be mainly, last week I told, it is mainly biological, chemical, energy, and environmental. These are the 4 things that you need to know that comes under health and safety risk assessment. So biological means in a workplace, are you getting risk to a particular virus or a bacteria, like COVID, like a cholera, like that, or a environmental or a chemical, like whether are you getting exposed to any toxic or corrosive chemical, because they can have a direct impact to your health, right? That is the thing that you need to understand. And the workplace risk assessment is like, how safe are you among the people that you are working with? Like, are they like harassing you in any in physical form, in a verbal form? You know, are they bullying you? Like that kind of thing needs to know in a workplace, right? And fall risk assessment is usually like, possibility of falling, mainly like, depends on people who are, let's say, who are disabled, or like older people, or they have a problem with their, like, maybe they have to walk through crutches, something like that. So those are the things of fall risk assessment. And construction risk assessment is, anyway, we see this mainly like on the roads, or even in your workplace. If there's a construction of building or something like that is going on, then that is a construction risk assessment. So again, direct meaning, but you need to know how they differ. Okay, so you need to know the types, different risk assessment used across industries, right? So I think Sanjeev already said, before I actually told, he already knows, I think, the 5 ways of risk analysis. You mainly identify what is a risk, and you need to know how you analyze a risk, and then you evaluate the risk, and then we treat the risk, and then we review the risk. And last week we got 2 examples, and one is about a fire in a workplace, and the other one is COVID. So for example, the fire is, how do you identify? Okay, I will ask a question from somebody, because this is the most important thing about this topic, so no harm sort of revising it again. Can somebody other than Taranga, because I think last week they answered, the newcomers, can you all give me an example how we bring a risk and how we can analyze that risk based on these 5 points, based on this 5 process? No problem if you all make mistakes, just give it a try. Any risk, I even told 2 example, any risk that you all can think of in your workplace or lab or hospital, that you can categorize into these 5 processes. Anyone from this group, anyone can answer. Sanjeeva, can we have you to volunteer, because you are already in this? I'm curious to know how you tackle this.
Let's say as a construction fields, some building is hazardous to fire. So we identify there is a fire risk.
Very good.
So then we analyze the how exposure is this. As example, what are the hazardous equipment in that building and the nearest places of that building, and what exposure is spread. So we analyze what is the if there is a loss, what is the cost, and what is the materials in that building. So those evaluation process, we analyze that part. So then evaluating means that the loss cost and the what is the maximum value of the loss and maximum probability of the loss. So then evaluation stage, we analyze that part. Then the treat the risk as an example, that insurance is actually the risk transfer mechanism. So that as example that you said is the that we can mitigate the risk, we can stop the loss, or we can transfer the loss, or we can
so how do you
get a solution.
What is your solution? How would you mitigate it? What are your suggestions?
Yeah, actually, we can give guidelines, and we can give that there are that fire safety solutions for
Very
that
good.
building.
So last week I
So
said the main thing is you can bring in what you call signs, right? Like, you know, if for example, if a fire can happen, how do you tell people? You should have a proper exit sign. So because a fire can have a panic situation, right? So they need to have signs. Okay, in case of a fire, please take this route. Please take the steps down. Okay, that's why signs and posts are very important. That is one way to treat the risk. You understand? So that's very good. And how would you review the risk? How would you review it?
It's actually according to the past experience of the same exposure of the risk. We get the data, and we analyze it according to the past experience. So that's the review part of that experience.
Very good, Sanjay. That's a very good answer. Thank you for answering. Anybody else would like to contribute? So the main thing is the fire. Last week also we got that. Anything that you can bring like a biological example? Because if somebody doesn't answer, I'm going to call the name out. Anyone who wants to volunteer? Because this is the most important part about this topic. How you, what are the 5 steps for a risk assessment? Fayaz, can we go with you? How would you bring an example?
Can I?
Please. Thank you. Thank you.
Some infection.
Very good. Okay.
First we identify.
What kind of infection? Can you bring in an example? An infection?
Like corona.
Very good. Okay. Excellent.
This is viral or bacterial infection, or it's Ebola or SARS or COVID. First we identify.
Yes.
And next we analyze. And it can spread. How to spread one person to other person, or when how it can what harm to anybody.
Yes. Good.
Who are coming from outside or who are working, who can be harmed.
Yes.
Like that. And then we evaluate and treat. What the methods that we prevent this infection: quarantine, sanitizing, cleaning hands, wearing mask, gloves, face shield, shut down for a week.
Very good. Very good.
And we review it.
How would Silani, how would you review it? That's the most important part. How would you review it?
According to the past things, we signs and post advise people for sure check your body temperature before entering, and aware the people who live in environment. Try to keep social distance like that.
Yes. So that's very good. That's obviously even in Sri Lanka or any country, when the pandemic first came, it was very new. So people didn't know what kind of advice to even give, what kind of mitigations to even take place. But after they learned about the virus, after they learned how this is getting spread, what they started was a lot of posts were coming. If you are in the elevator, try to maintain a distance of this amount of distance, right? 1 meter apart, and like that. And then they say, please wash your hands, take your body temperature, use hand sanitizer, because that is the best part about reviewing is first you need to know when you, like, it's like our life, right? Once you know the mistake that you made, you become wiser, you become more aware not to do it again. That's the main thing about review. Any accident or anything that you need to assess, you're always able to review is after you learn it. Even review your exam means what? You go for lectures, and before the exam we say review session. Why? You just recall everything that you studied. So review is also the same thing when it comes to risk assessment. Once a damage or a hazard takes place, based on your past experience, you bring in certain things so that in the future it will not take place again, right? So that's excellent. Thank you so much for both of you all, Tilani and Sanjeeva, for answering that. I mean, very good, excellent answering. So basically, just roughly, you always identify the hazard of an area, a specific task or situation, then you identify those who may be harmed, individual, visitors, workers, contractors, then you evaluate by looking at what methods are in place to control the risk or reduce them, then you record the finding, and then you help to remind everyone of what the risk and how they could reduce them, right? And then finally, we review and modify the risk when changes happen to the task or workplace, and this can increase the risk or reduce them, one of the two, right? So you need to do a proper review, right? So again, it's the same thing, identifying the hazard, evaluate a hazardous risk, decide on control measure to implement. This is the most important thing, the number 3. Once you identify and once you evaluate, no point identifying and evaluating if you don't bring in control measures, right? So that's the problem, like in many countries, like for example, countries who fought the pandemic very fast, like New Zealand, for example, and Korea, if I'm not mistaken. When the pandemic was an outbreak, they actually used very fast measures to reduce the prevention from spreading one person to the other people, right? But in Sri Lanka, what happened? Until the police started to raise the people who didn't wear the mask, people didn't want to, follow the rules and regulation. That's why there were so many deaths that took place in 2021, right? So that is the most important thing, is control measure to implement so that this thing can be stopped, right? Always you need to document your findings. Like I told this also when I was working for clinical research, none of the audits, when they come and check my work, if I have not documented anything, they would actually put it as a black mark, because they say if you have not documented anything, it is more like you have not done your job. So when my patient comes for the clinical trial, I need to tell, okay, my patient came to the site at this time, I checked the BP and the patient's BP was this time. So everything needs to be documented, either electronically or either through like mostly electronic database, and also we actually go through hard copies. But actually last time also I said that electronic database is the most efficient one, right? A developed country will always have their recordings in electronically captured. So you need to always document your finding. So for example, another good example is, let's say somebody like, say, Taranga is in the company, she documents everything, but she resigns or she quits the company. So the next person who comes to her job can continue her job from where she stopped, because now Taranga has documented everything. So it's easy for the newcomer to continue her work because now everything is documented. So can you see, the documentation is very, very important. Very, very important. So that's a must, that it need to be followed in a risk assessment. And then finally, you review assessment and update if necessary, right? And also, quickly, if you go through the step-by-step process to carry out a risk assessment. Let's ask by one. Let's start from Taranga. Taranga, what do you mean by what is your scope when you carry out a risk assessment? Let's take it as a recap today. What do you mean, what is your scope, Taranga, here? You all can read the answer and can tell it in your own words. Taranga, are you there?
Miss, give me 1 second.
Yes. Anybody would like
Can
to?
you ask from other?
Okay. So, okay. So, Tilani, can we ask from you, starting, what is your scope when carrying out a risk assessment?
What resources we have to need at the fire? What are the equipment or equipment to stop this fire? Fire tank, exit area, like that.
Okay. And Sanjeeva, what would you think you need and who is involved? How can you answer those two? Two questions for you. You can answer it in your own words.
Sorry, I couldn't get you.
So I'm just saying, if we have to carry a step-by-step process to carry out a risk assessment, Tilani said what she mentioned about the scope, right? Like a fire. During a fire, she said what are the equipments you need to stop the fire. So what is your answer in terms of you need and who is involved? When you're carrying out a risk assessment, what is your understanding about you need and who is involved from this lecture slide?
Basically we need to identify some kind of a risk category, mainly what type of property. I mean, is a let's say it's a construction site, so it's involved lots of hazardous equipment.
Very
And
good.
also the people who work there, what is their job occupations, and what is uh, the number of employees at the time of work, anytime,
Yes.
and the job category, and if it is a hazardous or non-hazardous,
Yes.
and what are the equipment they use, and what are the surrounding area of that property.
Right.
So, and what are the fuel types? I mean, gas or petrol, or what are their storages?
Very good.
And all the data we have to get to before we determine the risk analysis.
Yes.
So, yeah.
And one more question. Do you think when it comes to risk assessment, everybody can carry out a risk assessment? Yes or no? Do you think it's the correct way? Do you think everyone can risk assessment?
Every that's mean, madam?
For example, when let's say a fire started in a place, you think everyone can mitigate that fire or douse the fire? You think everyone is qualified enough to do that?
No.
Yes, so that is very important to remember. There are different kinds of risk. So, for example, a COVID risk, you need the specialized, the paramedic, you need the specialized doctors, the nurses to carry out to mitigate that risk. So, when it comes to a fire, you need to have the firemen, the people who are specialized for that role needs to be taken into consideration. Not everyone carry out a risk assessment, right? So, for example, the risk that you see in a healthcare management is not the risk that you can see on the roads. It's not the risk that you can see maybe in a company, right? So, risk that comes in different locations can differ, and different situations also can differ. But for each of the risks, we should have the specialized people who could carry out that assessment. So, this is something that you need to understand also. So, all of you all know, but I think you all didn't tell it, so that's okay. So, that's why you need to know you need and who is involved. I just wanted to like get that answer. People who are really specialized for that particular task needs to be involved. And for example, if the fire comes, you need the fireman, right? And you need the tools, the fire brigade, the fire hose, like all those. That's what you need to sort of understand. So everyone answered well, so good. Okay. And the last one is laws and regulation and internal policies do you need to comply with? So the answer is yes. So the very first lecture is I taught around 15 internal policies and regulations. So I said healthcare management, just not one policies that is need to be followed. There are so many policies that they have implemented. Just for handling toxic chemicals and corrosive chemicals, we have a different kind of policy. To handle equipments, we have a different kind of policies. When you are dealing with people who are unable to walk or bedridden, we have a different kind of policies. So because humans are quite complicated and our work things are quite complicated, they have implemented different kinds of internal policies and regulation just so that the workplace can flow smoothly without any interruption. Is that understood, students?
Yes.
Okay. This one we are almost closing up. Hazard versus risk. Can somebody, before I put the answers, recap for me what is a hazard and what is a risk?
Hazard is a cause. As example, we say it's a fire or cyclone or that illness. So that is the cause. But the risk is the likelihood. something going to happen, that means whether it happen or not, it risks mean the possibility of the loss.
Very good.
Yeah.
Very good. So, can you give me an example to elaborate? You define the terms, which is excellent. But
Yeah.
give me an example.
Let's say in medical field, I'm not familiar at the medical field, but let's say hazard is, let's say COVID.
Very good.
I don't know. Yeah, hazard is a COVID. The risk means the how possibility it influence.
Well done.
Yeah.
Well done. That's an excellent answer. You have perfectly understood. So last week there were few confusion among the students. So if I'm to elaborate again, hazard is something with the potential that can cause a harm, right? Anything that can cause a harm. So for example, HIV virus is a hazard. COVID is a hazard. Ebola virus is a hazard, right? And the risk is if one person has COVID and if another person goes in contact with that person has a risk of getting the COVID, right? Or for another example, let's say there is a building construction, a very dangerous building construction is going on. That is a hazard. The risk is even if there is a board saying, please don't trespass this area. If you do trespass, you can, get yourself into danger. People don't listen. They still pass that. And that is a risk that they put themselves in. So you need to know hazard is something potential to cause harm. And the risk is actually the likelihood of getting that harm onto you. Right? So, for example, there is a HIV patient. They injected somebody got a, say, blood transfusion through the needle. So that needle is actually a hazard. And accidentally that they get a needle prick is a risk because they can have a chance of getting the HIV because the other person had HIV in that needle. So it's very clear. Hazard and risk is something causing and something that you can definitely get it. Anybody has any doubts up to now? The newcomers? Fires and all the rest, are you all clear? The ones who couldn't join last week.
I'm clear.
Very good. Taranga, where are you? Are you still there on the class or still not ready?
Yes.
Okay. So the most important part of a hazard reporting is that you act very quickly. This is the most important thing. You have to understand hazardous meaning something that can cause something that can cause harm to your life. It's something detrimental. It is something life-threatening. So anything life-threatening needs to be act promptly. So for example, if you see somebody having a heart attack or having an epilepsy and falling on the ground, you can't take your time. Okay, let it be. It's not serious. No, you need to act fast, right? You need to bring the basic life support. That's what I said last week also. Learning the basic life support need not be for a paramedic or a doctor or a nurse. I think everybody, including myself as a biomedical science researcher, I need to know the basic things when I see somebody on risk. When somebody is in a heart attack, I need to know how to do a resuscitation. Okay, when somebody is going through an epilepsy, I need to know how I can help this patient. Or when somebody is having a choke, I need to know how I can bring that thing out of the epiglottis. Okay, so basic life support is something that you train a normal person to act fast when you see another person in danger. So that is why you need to know when to act fast, because something hazardous means it is life threatening. Okay. And this is the one I also wanted to mention. This is very important, like, the signs, not only in a healthcare sector, but you can see these signs even in before you take your driving license. To those who actually are driving, so they actually have in Sri Lanka, I had to go through 2 exams, right? The practical and then also the theory, right? So the theory exam is all about learning the signs of roads, because if you don't know like where to turn, what is a roundabout, what does this post mean, so like that, just like you have signs to get your driving license, you also need to know the signs in a healthcare sector. So this is a common sign that you see in the labs as well as in a healthcare sector. So this skeleton, you call it if you see this, actually, can somebody tell what does this mean? Someone who is very familiar. The skeleton, what does this mean? The most common toxic. Very good. And do you think it can kill you? Do you think this can kill you? This sign?
Yes.
Yes, it's the most
Poison.
poisonous. Very good. It's poisonous. I think this we have seen since we were as children in the labs. You know, in chemical bottles, it's very. Actually, they say if you drink this kind of a potion, you can die. This is something explosive, right? So there are different kinds of signs and symptoms that actually explains in a hazardous workplace, right? So hazardous substances found in health and social care environment, including cleaning material, disinfectant body fluids, medication, clinical waste, contaminated clothes, towel and bed linen. So these are the things like, especially people need to be very mindful when you're actually discarding these waste, because, when you don't discard properly the disinfectant body fluids or towels, people around there who are working can get sick. Even the new patients who come to the hospital can get sick. So that's why they say hospitals also need to have a proper setup how to discard these polluted things or these unhygienic things, because it's very important to prevent the spread of the disease from one person to the other. So it's very important, right? So I'm actually going very fast. Can somebody tell me, the ones who didn't join the class last week, what is a consent? Why do you think a consent is important?
Permission, no?
Yeah, permission. But can you tell me, in a healthcare sector, when do you need to have a consent? I gave a good example also last week. Who remembers? In a healthcare sector, when does this consent come into play? Students?
Before operation.
Very good. Before operation, yeah. So can you elaborate that example a bit? Okay.
If we are going to the operation, they should have to get permission from us.
Yes, very good, very good. So like, for example, let's say somebody is having a tumor. Okay, so let's say a breast cancer patient, right? So even if that lady knows that her tumor can spread, if that if that tumor is not taken, she has the right to give the consent whether she wants to go for the surgery or not. That is up to her. I told this last week. It's her body. She has the decision to make, even though she knows that cancer can spread. So if she says, no, I'm willing to die, I don't want to go through, because a lot of people, it's very sad, especially women after 40, and especially unmarried women, they have a very high tendency to get breast cancer, right? So if the tumor is not taken off, the cancer can spread, and the sad part is, even if you do the surgery, they still need to go through chemotherapy, right? So a lot of people, they don't want to suffer. They don't want to suffer. They say, okay, death is okay for me. So it is up to them. As a doctor, you can tell them these are the possibilities if you don't do the surgery. And after the doctor does his part, it is completely to the patient's decision whether she wants to go with the surgery or not. She has to give the consent. And another example I told is, you can make the decision on another person's behalf if another person is mentally retarded or completely paralyzed, right? So if that person cannot make a decision, a loved one, say the mother, the father, the husband, or the wife, can make a decision on behalf of that person. So there are different situations. So this consent is something very important. If you do a surgery without that person, someone who is brain functioning, if you do the surgery without their consent, you can actually have a lawsuit. You can put that person to prison, whoever does the surgery on them without the consent. So that is very important, right? So that is just a additional idea that you need to know what is a consent mean, right? And just a quick recap. First aid. Who knows what it means by a first aid? Again, last week I asked a question. What is a first aid?
First action.
First action. Taranga's.
First action, and also the first thing we are giving.
Yes. Yes, that is Taranga. Taranga has the best definition for first aid. No Taranga. I remember first action, right? Yeah, that's correct. That's correct. But what do you? How else can you elaborate a little bit more, Taranga? First aid. I know first action, but like if you can elaborate a bit more.
First
Basic
thing
steps.
that I
Yes, somebody answer. No problem. Yeah, go on. Where do you see a first aid? Where does a first aid should be? This is the biggest risk. This is the biggest tricky question I ask. Where should a first aid be? Sanjiva, where do you...
help given to the sick or injured person
Yes, but my question is, where should a first aid be?
everywhere.
Everywhere. That is something that you all need to remember. A first aid should be everywhere, right? It needs to be, for example, of course, I know sometimes at a home, maybe nobody is a doctor, no doctor is available, nobody is there, but so you don't know how to treat a heart attack patient or a stroke patient like that. But you can still treat something with regards to a fever or so say something simple like a diarrhea, like you have basic knowledge of certain things. When you have high fever, you can quickly give a Panadol. That is something not a rocket science. Everybody knows what you need to do when you have a high fever. Or when you have a cut, everybody knows, okay, you need to wash it with a clean water, add surgical spirit, everybody knows through common sense. So that is why I said first aid is something that needs to be everywhere, not just the hospital, but at your home place. Like if you know your parents take these kind of medicine for cholesterol, these kind of medicine for diabetic, you have to have properly categorize those drugs as for timely, hourly, like that. You need to categorize. You have to have your paracetamol, your bandage, your plasters, your Dettol, hand wash. Basic things needs to be there at home, and it also needs to be in school. It also needs to be at workplace. If somebody goes through a dehydration through a heat, we know what is the first thing that you need to do. You need to hydrate that person, right? Or for example, let's say through say a cut comes, what you need to do. So the first aid is something that needs to be everywhere, right? So that is something that you need to know, right? And sorry, there are 3 levels of first aid, right? I think from here we didn't do this. Taranga, we didn't do this last week, right? If I'm not mistaken.
No, miss. No, miss.
Okay, so I think I just recapped all this and the slides. Anybody, I will start the slide lecture for today's slides. Can anybody ask any questions that you all didn't understand up until now? I just quickly went through because the lectures were done last week, but because it's a continuation of today, I wanted to sort of recap. Anybody has any doubts, please ask, no problem. And if you all have anything that you all want to add, please add.
Excuse me, madam.
Yes.
May I ask a question?
Yeah. Go on. Please go on.
Yeah, madam, you said that the concern thing. So you said it's what I understood is normally that before operations and treatment, sometimes the hospitals gave us a fill of form.
Yes.
Asking that our allergies and the concern of the operation.
Yeah.
So, but I thought it is for their that for their legal consideration for not bind any responsible for that patients. So, is it for their legally responsible that they are not getting for responsible for that cause for that patient, or is it for get important information? I mean, uh, we have a right to not sign for that concern before the operations.
It's like this, Sanjeev. So I'll explain to you again. So, for example, a consent. If I'm to talk in terms of a surgery, let's say that someone called Jack, right? Jack is having a tumor, right? Now the tumor needs to be operated. So if you don't operate the tumor, the cancer can spread. So yeah, the doctor is solely responsible to tell Jack, you have a cancer, and if it's not going to be operated, your cancer can spread. So now the doctor informs everything to Jack. But Jack has the right whether he wants to go with the operation or not. You understand? He can decide for himself whether he wants to go with the surgery or not. It is completely up to his decision. So the doctor cannot operate on Jack, even though the right thing for the doctor to do is to do the operation on him. He cannot perform the surgery on Jack because Jack has not given the consent. He can only perform the surgery on Jack only when Jack gives the consent. That is the first example. The second example, let's say Jack has a daughter who is now paralyzed and she has to undergo a crucial surgery. Because Jack's daughter is unable to make decision because she's paralyzed, she's quite, not in her conscious level. Because Jack is the father, and if the doctor says, oh, Jack, your daughter can recover if the surgery is done, then the father has the right to make the decision on behalf of the daughter. You get what I'm saying?
Yeah. Okay.
That is the difference you need to do. I understand. I understand that it can be confusing, but did you understand the example now?
Yeah.
Yes. Is there any other questions that you all have? Please ask, because I like when you all ask questions, because I am open to any kind of question. That's what I said at the very beginning. I don't want to just, read the slides and go. I want it to be an interactive session. So you all need to ask and, and I can answer. So is there somebody also wanted to know anything? Please ask.
Can you explain again, Miss, morbidity and mortality?
Yes. Okay. So last week I used the two terms, morbidity and mortality. This is a very medical term. So a morbidity means somebody's walking is going to be stopped. So for example, let's say that somebody had a diabetic patient has uncontrolled diabetes, and what happened is that person had a wound in the leg, and ultimately because of a gangrene. I don't know, these are a little bit medical terms, so don't worry. Gangrene is like I will not use medical terms, maybe it's too much for you all. Okay, so let's say, how can we say, car accident, somebody had a very bad car accident, and what happened is that person lost the leg through the car accident. So they have to, now that person has lost one leg. So now that person cannot walk anymore. That is what you call morbidity. The person's walking is actually now stopped. Mortality means a death. Mortality rate is the death. So for example, due to the COVID pandemic, the amount of death cases that happened in 2021 in Sri Lanka is almost 50%. 50% of the people died because of COVID. That is the mortality rate. So mortality is death. Morbidity means something that has obstructed a person's walking. Is that understood?
Yes, got it.
Okay, good. Right. So I think we can start today's lecture. So this is also going to be a continuation. Give me a second. So today is lecture 5. Yeah, so basically under the principle of health and safety for health profession, all the very first two lectures were all about, like I said, medical health records, regulations, all those things. But now we are mainly learning about how we describe risk assessment, which is used in the health and social care. Then how you carry out a risk assessment, how you implement recommendation of a risk assessment, then how you evaluate the effectiveness of a health and safety practice, policies, procedures in the setting, and those are the basic things, right? So this is still a continuation from last week's lecture, which we already learned last week, which we had a recap, but we will continue today also. So most probably we have a little bit more. So these are the learning objectives. So I think maybe I'll come for the video end of the lecture because I want to continue. Yeah. So today we are going to learn a little bit more detail the two types of risk assessment methodology. How do we, based on a method, how do we assess the risk? So the first one is quantitative risk assessment. Can somebody tell me what is a quantitative risk assessment? From the word, when you say quantitative, what do you understand by a quantitative risk assessment?
That word means amount, no?
Yes, amount. Yes, very good. Can you give me an example? Quantitative risk assessment.
How consequences happen, if it is a medium or major, or how that could be.
Okay. Can you give an example? Can somebody give an example?
How many people are affected?
Very good. Quantity amount. Yeah, that's a very good question. So say your company, again, I think I come again and again, we are sick of hearing COVID, I think. So let's say a COVID patient comes suddenly, and now suddenly from one person, it has come to 5, then 10, 50. Now you can see, oh my God, every day the amount of people getting COVID positive is increasing. So it's a quantitative, the amount, right? So that's a concern. So in that situation, the manager of the healthcare sector now understands, oh, okay, now this is a bad sign. Every day we are getting the number of COVID positive people high. So we need to now go on a sort of a lockdown in the place. Otherwise, this is going to be bad. More and more people are going to get positive, and eventually people can have other adverse health repercussions, because you understand in a workplace different criteria of people are there, right? Different ages. There could be very old people, very young people. Some people are very good in health. Some people have comorbidities. Comorbidities means like people who have like diabetes, cholesterol, hypertension. So we say when you have high comorbidities, these people have a high risk to get COVID. So that is one thing you need to know. So that's a very important when it comes to a risk assessment. The amount of quantity. Even for example, another, can like somebody give me another example before I give an example? I like getting the answer from you all. Can you all give me another example? Somebody said about the amount of people. Give me another situation, amount of people in, but now I told about COVID. Anything else that you can bring a quantitative?
When, as example, if we get a tsunami risk, the number of the severity of the people in the sea area and the fishing area.
Very good.
Yeah.
Excellent. So that's very good, because don't worry, y'all don't need to like what do you call, narrow down your answers just to healthcare sector, because I told you last week also, risk assessment is something that is seen in every area of life. You have your own risk at your own home. Understand? You have your own risk in your own company, even if you are not working for the healthcare sector. Hospital, yes, because it's healthcare. Labs, yes, but don't narrow down your answering just for healthcare. You can just elaborate. Yeah, tsunami, how many casualties, people who got affected by the tsunami? Quantitative risk. So next time we need to tell, okay, try to build your houses this amount of meters away from the sea, right? That's right. Remember, see, you come back to that 5 steps. If you remember the 5 steps, you can answer any question, right? So they say here, quantitative risk assessment focus on the numbers. To perform a quantitative risk assessment, a team uses measurable data points to assess the risk and quantify it. So all of you all understood that. Excellent. To perform a quantitative risk assessment, your organization will start by compiling 2 lists. That is, first is the list of possible risks and the list of your most important digital assets. The second list might include items such as valuable information, your IT infrastructure, other key assets. And once you've made your list of assets, you'll assign a dollar value to each item. This can be tricky for line items such as customer data or other valuable information for which there is no set financial value. Now, I will explain a little bit because this might seem a bit too much for you to understand. Before I explain, can somebody explain to me why do we bring the financial value here? What is the reason we're bringing a financial value here?
That is the monetary value or the cost of the loss.
Very good, excellent. I think that is very well answered. Cost of the loss. Really like the term. Cost of the loss, exactly. That is the whole summary of it. Thank you for that. Imagine like the first thing, be it in any country, right? Developed or developing country, the first thing, be it any damage that happened, the first thing that people will always be concerned about the loss of asset, the loss of investment, how much this loss cost them. Because if you go to see, anything in our lives matters about the financial aspect, right? So if the financial ground is not strong, one thing is you can't help yourself, you can't help the country, you can't help your loved ones, you can't help anybody. So for example, when the tsunami came in 2004, we know there was a heavy loss of damage for property, for money, people's lives, people's, everything. Financially, the country got, it was a breakage thing. Now, for example, the whole crisis of Sri Lanka. Financially, we are like bankrupt as a country, right? So imagine, I told this last week also, it's like the cobweb. It's like the cobweb. Finance is like the spider. So if the spider is broken, all the web that the spider makes is going to be broken. So it is the finance that interconnects you to your healthcare sector, that interconnects you to the HR, that interconnects you to the infrastructure. So if this spider is killed, everything that connects is also going to be demolished. So that is why they are saying in a quantitative risk assessment, the main thing is you need to see the financial value. So imagine in a company, if everyone starts to get COVID positive, people who are working there cannot come to the work, everything is going to get, interrupted, the money inflow is going to stop, the money outflow is going to stop. That's why during the pandemic, why do you think many companies had to shut down? Financially, it had a huge impact. Many people lost jobs, many people had to leave the countries who were employed there. So could you see how the risk assessment can connect to so many things, and one of the main thing is the money, the finance. Is that understood, students? Yes or no?
Yes.
Eventually, any risk is always, why people try to mitigate is to bring this financial stability. People don't want, because why do you think before construction or the foundation of a building or any infrastructure happen, why do you think they get good architects? Why do you think they get good engineers? Because they want to make sure that the place doesn't have any danger, because if it happens, a huge financial loss, right? So if you have a fire outbreak or something bad that happens, that is poor foundation laid on, poor infrastructure, they didn't get quality architects, they didn't get quality engineers. Because if that happen in the future, it's a huge loss financially. People cannot come for work, the whole thing is now damaged, it's destroyed. Financially, it's a huge investment. People can lose jobs, so many things. So everything, why one of the main reason to assess a risk is the financial ground, right? Because if the financial thing is broken, everything else is broken. So, for example, in Sri Lanka, now because of financial loss of the country, people even to have basic paracetamol, they don't have basic paracetamol. If somebody has a dog bite, that person cannot go to the hospital to get a medication for that. It's a very sad state. You remember like 3 months ago, a child died because there was no Panadol syrup for that child. So many situations happen because when the financial situation of the country collapses, medical sector collapses, children's school collapses, people's job collapses. So that's why it's a risk. It's a risk now, right? You need to understand that. Quantitative risk assessment. Right. And Yeah, so that's basically that. And the second one, qualitative risk assessment. What does that mean? All of you are told quantitative is something to do with number. What is qualitative risk assessment? What is qualitative risk assessment, students?
Types of risk.
Not really types. When you say quality, what do you mean? What do you mean quantity versus quality? Quality means what? What is quality? The term. What is the term quality means? What do you understand by quality?
Correctly.
No,
Good or bad?
Very good. Exactly. Good or bad. I mean, for example, let's say that, something like, for example, anything made in Japan, made in Germany, we know if you see something like, quality is good. But, when you see something made in China, what does your idea be like? Oh, maybe the quality is not so good. That's why the price is less. But when you see something like made in Japan, made in Germany, something like that, if the price is high, okay, the quality is good. And it's true, something expensive is a good quality. Like if you really buy something authentic and something really quality, it's quality because how do you know something is quality? The durability, how long you can use. If you can use something for a very long time, we know the quality of the product is good, right? And if it can, so if you take, for example, a good laptop that you are using for 10 years, no virus attack, no, no malfunctioning from, on viruses, so the quality of the laptop is good. So quality means something like Taranga said, good or bad, and how durable it is, how long you can use. So how does quality risk assessment come here? How do you do a quality risk assessment? How can you bring a qualitative risk assessment? What does that mean? Can you all guess? I'm trying to get the answer from your list because then assessment is easy. Yeah, go on.
That risk is high or low. That
Not really high or low. No, you're there. I wouldn't say that it's completely right, completely wrong, but the answer is still not accurately there.
major or minor. That risk is major or minor. We have to find.
Anna, right. That I think I understand what you're saying is if you can analyze a risk, categorize it properly. For example, if a manager who is in charge to assess risk assessment or to analyze the risk assessment properly, if the manager knows in the company to analyze the risk assessment properly, this is high severe, this is moderately, this is low risk. If someone can categorize the risk properly, that is a qualitative risk. So for example, I will tell a manager identifies a carcinogenic substance as not so high risk. Is it a qualitative risk assessment? Yes or no? He says toxic substance is not high risk. You think it's a qualitative risk assessment?
No.
No. A person should be educated and a person should be, well informed and needs to really know what he's doing properly. That is a qualitative risk assessment, right? So what has happened, for example, many healthcare sectors, if a qualitative risk assessment is not done properly, people can get susceptible for diseases, for dangers. So qualitative risk assessment is a must. You need to identify toxic substances as toxic, carcinogenic substances as carcinogenic. If people identify carcinogenic substances as not carcinogenic, that's a huge blunder, right? It's like somebody telling 2 plus 2 is 6 and not 4. Not a qualitative analysis, right? So that you need to understand. A qualitative risk assessment is less about numbers and more about what would actually happen day to day if one of the risks on your list were to occur. That is very important. Like you need to analyze, okay, if a fire breaks, there is a huge risk that the whole department can catch fire. People in that department can die from a fire burns. Their properties, their health is jeopardized. That is one thing. And the other one is, while a quantitative risk assessment is straightforward and number based, A qualitative security risk assessment methodology is performed by talking to members of different departments or units and asking them questions about how their operations would be impacted by an attack or a breach. Okay, so just let's understand this. What does that mean? What does that mean, students? The first 3 lines. Read it and just tell it to me in your words. I will definitely explain it to you. What does that mean?
That means that qualitative refers the feelings. It cannot measure quantitatively.
Yes. Yes. So why do you think, like, what do you mean by how operations would be impacted by an attack or a breach? Sanjeeva, do you know what is a breach?
Which means conflict of something.
Yes, like you say we cannot breach somebody's privacy. You cannot. You say you, for example, somebody has personal information, right? You can't hack into somebody's laptop to know, okay, what are their personal things. You cannot breach. That is what you call breaching into somebody's privacy. That is the word breach. So you need to know, you need to carry out operations such a way that you don't breach somebody's privacy. Like, for example, let's say the fire occurred. There was somebody there when the fire took place, but the manager needs to understand how to handle the situation. The manager cannot, like, overly, like, go beyond a person's personal thing and, test him in a way that will breach his privacy. He can't say, oh, give me your phone, I need to know what you were doing at that time. He can't do that. There is a way to do things. You cannot, everything needs to be done very professionally and morally and ethically. It is very important, especially when it comes to healthcare sector. Anything needs to have ethics, values, morale. It's very, very important. Right? Like, and the last one, they say you might also ask customer facing teams how a breach will affect service delivery, or those who manage vendors about how an attack will interfere with supply lines. So, like, for example, let's say another example, let's say that you need to bring in medical supplies. Say a pharmacist needs to bring a medical supplies to a company, and he got delayed to bring these medical supplies to a workplace. So there is a way, and because he got delayed, a lot of other things got affected. So as a manager, there is a way to handle him. Okay, you got delayed to bring the medical supplies, and because you didn't bring it on time, there is a problem in our area. We couldn't supply and we couldn't attend to the needs of the patient. So there is a way to handle him. You can't say, oh, show me where you were at this time, show evidence. No, you can't do it like that. There is always a way to handle the situation more morally and ethically. That is the most important thing. Okay. So is that understood, students? Anybody, do you all have any other questions, students? Do you all understand what is a qualitative risk assessment is about?
Yes.
Okay. If you all have any doubts, if you all feel like it's not clear enough, please ask. I can explain. No problem. You need to know what is quantitative. You need to know what is qualitative. How these two terms.
Excuse me, someone's the mic is not working.
Okay, no problem.
He put the messages.
Oh, I didn't check the message. I'm sorry. Did you put it in WhatsApp or did you put it on the chat box?
Chat box.
Okay, I'm sorry, because the thing is, when I'm doing the slides, I cannot read the chat. I'm sorry. Let me just go. Yeah, hold on. Okay, no problem. Okay, no problem. If you all are leaving the class, that's fine. For an emergency situation, no problem. As long as you all watch the recording and whatever you all have. Okay. So the last point, you need to understand qualitative risk assessment aren't as precise as quantitative assessment. What does that mean? What does that mean? Qualitative risk assessment aren't as precise as quantitative. Can somebody explain to me what does that mean? What do you mean by precision? Precise?
Exactly.
Yes. So, in your opinion, which one do you think is better, qualitative or quantitative?
Qualitative.
Yes, qualitative is more precise, but doesn't mean that quantitative assessment doesn't serve a purpose. It does serve a purpose, right? You need to know, end of the day, if somebody got affected by COVID or how many people got damaged by tsunami or like that, you need to have a casualty. You need to know the numbers, right? But they're just saying, that's what they're saying. They provide an important piece of information, but the qualitative risk assessment is more precise, right? The quality will be more precise. So that is what you need to know. So if you know ahead of time how a risk might impact each team's productivity, you can have a backup in place to mitigate those risks. So that's why they are saying both qualitative and quantitative are important, but just that the qualitative is more precise, but doesn't mean that quantitative doesn't serve a purpose. Because if you know both parallelly, there's a very good chance that you can mitigate a risk that can happen in a workplace, right? So that is something that you need to know. Okay. Right. How to carry out health and social care risk assessment. Can you all give me some examples, students? One by one, you all can just give an example how to carry out a health and social care risk assessment. Sanjeeva, can you give me I'm always calling your names so that other people can get motivated to answer. Can you, so that they won't be scared? How do you think you can carry out a health and social care risk assessment?
Let's say, firstly, according to my knowledge, first we have to choose a area. Let's say if I choose in my town that age people. So first we have to get all the details of the age people. Let's say if more than 60 or more than 55 or more than 70. First we have to get those details. And then we have to get information about their illness and what is their health care conditions. Hello?
Yes, I'm listening. Very good. Very good. Go on.
Yeah. And uh, and they get the information about the full health report from the nearest hospital of those who age more than that age group. Yeah. Then according to that, those informations, we can analyze what are their needs and the requirements of the through social and healthcare ground.
Right. Very good. That's a very good elaborative answer and good. It's a good example. Like that, somebody can give an example, like how Sanjay was said. Students talk. I will not scold. Even like I said, if you all even feel comfortable with Sinhala, you can tell your answer in Sinhala. But because majority of the students message me and said they want to learn English also while I teach, so that's why I don't use Sinhala much. So if there is anyone who understood the question but feel comfortable to answer in Sinhala, please do so. I want you all to interactively participate. Sinhala,
Yes, first,
you can. Yeah, come on, Tanvi, tell.
yes, first we have to identify the hazards in risk assessment. Okay, then then after that we have to establish who might be harmed.
Yes, who might be in danger. Okay, okay,
Yeah.
okay.
Then after that, we have to evaluate.
Right, right, right. Yes, correct.
Okay,
So,
then after that, we have to.
yeah, example, Taranga. Like if you can give an elaborative example, like Sanjeeva, how would you elaborate a little bit more? How like
That corona.
okay, everything is COVID. Anything else that you can think of more than COVID and fire?
Then
We can get that if it is a flood situation, we can get the flood report and the affected properties and the cost of loss.
Very good.
And what is how big of the loss,
Yes.
and those informations and how to mitigate it. Yeah.
Yeah, okay, very good. So I think you all have an idea and you all gave the answer. So that's really great. So let's see the first point. Step 1 is you must gather the information to identify the risks and hazards. So Aranga and Sanjeeva both said that. What is the risk? What is the hazard? So you need, that's why, could you see like in my slides, why I mention everything very, the simple terms I will elaborate so that when you all go through my slides, it's not difficult. So by now you all need to know, like you all already know what is a hazard, what is a risk, okay? So you need to know, get the information about these two things. And then in residential care, for example, hazards will typically be identified during a thorough inspection of the care premises. So for example, residential means like your house area, right? So maybe say in your residential area, there is a dengue outbreak, right? It's a hazard, right? So how can it be a risk? So if you all are in the night not sleeping with mosquito repellents, or if you all are not sleeping under a proper mosquito net, you have a high risk of getting dengue, right? So, and also, why do you think that thorough inspection? Usually, there are people who come, healthcare sectors monitoring, people can come to see, okay, have you all kept your garden area clean? Are there any places to see if the water is getting accumulated? They come for inspection. Why they do that is so that, to prevent or to reduce this dengue. So have you all come across, usually now I stay in the Dehiwal area and it's very high for dengue. So usually like there's a inspection that comes, right? So for to see if there is, properly the place is kept clean, the water is not getting accumulated, right? So that is one thing, right? Inspection. And step 2, you determine who might be harmed and how. So for example, again, dengue, we know children who are like under the age of 10 or under the age of 5, they have a very high susceptibility. And usually we see, especially in Sri Lanka, the amount of death rate or the mortality rate is usually higher in children because, the platelet count goes very down. And the other one is the elderly, the very old people. They are the most vulnerable people who can get affected by dengue, right? So that is to see who can be harmed. Yes. Any questions?
No, ma'am. And also pregnant mothers.
Yes, pregnant mother. Very good. Thank you for that. Yeah. When you say vulnerable people, it is usually people who have a very low immunity. When your immune body doesn't fight, that is the people vulnerable group. That is why, like, usually in COVID also, the vulnerable people were mostly the elderly and the people who had comorbidities. The mortality rates were very high in those people, right? Comorbidities means like the people who have diabetes, hypertension, cholesterol. And elderly people is like people who are like above 50, 60, they have a very high tendency. Like, their oxygen perfusion amount is very low and all those things. So that is who can be harmed. Anything in any risk assessment is you need to know the vulnerable people are children, pregnant mothers, and the elderly. Anywhere we go, these are the vulnerable people, be it in the war zone, be it in the hospital. We have vulnerable sector of people, right? Third one, so sorry, the second one, when you say who can be harmed, to elaborate it, it means it's important to record not just the groups that are at risk of harm, but how each group is specifically at risk. This is also very important. Okay, the vulnerable people are children, elderly, pregnant mothers. So they also need to, after they find out or identify that these three are the people who can be specifically harmed, they also need to know, okay, how are they going to be harmed? Now, people who have hypertension or cholesterol or diabetes, you know, if you are going to give them something food, you need to be very specific. Okay, their food should not have high cholesterol, their food should not have high sugar, their food should not have high salt, because that can affect them. So when it comes to children, you know, now for example, in countries, in European countries, they don't encourage the small children to wear the mask during the COVID era, because they say children have a low oxygen perfusion because their lungs are not so developed, and if the mask is worn, the amount of oxygen that they can take into their body can become less, so they can become hypoxic. Hypoxia means low amount of oxygen. So you need to know that once you identify different categories of people, how each of these people can be affected in different situations. Do you get what I'm trying to say, students? Yes or no?
Yes, and also Miss wheezing people and asthma people.
Yeah, asthma, exactly. That I actually, this was very, that's why when the COVID came, the first thing they quickly asked, are you asthmatic? Do you have wheeze? Do you have, you know, like, you know, you have, are you a smoker? Because many people who had emphysema, who had chronic obstructive pulmonary diseases, they were very high chances that they actually had a very high death rate. Right, very high death rate in these people whose lungs were very weak, because you know COVID is a disease that already affects the lung, right? And to add that, when they find out that this person is already having a lung disease like emphysema, asthma, wheeze, it's a different a concern. You know, you have to really act fast. You have to really try to bring them a lot of, you know, nebulizing, bring the oxygen saturation up, and you know, doctors really sort of get stressed out when the oxygen saturation level comes very down in these kind of vulnerable people. So you need to really act fast for these people, right? That is one thing. Third one, evaluate the risk and identify the possible controls to mitigate those risks. So what does that mean? Like, it's important to evaluate how likely is that harm will occur, how serious could the harm be, what steps are already being taken to control the risk, and what further action should be taken to control the risk. So see how nicely the way that you can bring in risk assessments, it's very methodical. So again, once you evaluate, right? Once you evaluate, like let's say an emphysemic patient or a visa asthma patient is having COVID, you evaluate how likely is this harm going to occur. Very high chance that the person can die because the person is already having a weak lung. And how serious can that be? It is very serious. So if there are ventilators, only one ventilator, and you have a COVID patient, one is 18-year-old teenager who is having COVID, but you know, quite okay, quite normal, but has but is COVID, and the other patient is like, you know, severely comorbidities, you know, has asthma, at this. So the ventilator should be immediately given to the person who is at a higher risk. It's not that we don't treat the 18-year-old teenage, but you need to act fast now. Especially in a country like Sri Lanka, you know, people were running out of ventilators, people were running out of beds, right? And there was a time that COVID patients were sleeping on the ground because of resources, lack of resources. So at that time, the doctors need to think who deserves it, not like others don't deserve, but who needs it more, right? If someone who is really in a vulnerable situation, you need to act fast and think, okay, this person deserves it more because they are at a higher risk, right? And the next one is what steps are already being taken to control the risk, like the ventilator. You know, this person, this comorbidity, high wheeze, high asthmatic patient is now COVID, so the risk, they have a higher chance of dying, so we need to give the ventilator. And what further action should be taken to control the risk? Aside from the ventilator, you have to quickly give them a high perfusion oxygen, give them nebulizer, put them on, you know, steroids. You know, you need to really act fast, right? And, you know, high dose of vitamin C, their health, their everything. You put them on ICU, right? So just imagine, that's what I said, a risk assessment. Different situations, based on the different situation, you need to know how to act, and how you act is very important. Is there any question, students? Up until now? Sanjeev, do you have anything to add? Because you have already the background of risk assessment. I'm curious to know whether you can add more than what I also know. Or anyone else?
No, you explain everything actually. I am at the that insurance field. It's a kind of a different analysis of the financial field of the transfer mechanism, but in medical field, experience and the knowledge that you explained well and we understood the study materials.
I'm happy. Yeah, because I think because you have a background in finance, I think your field must be interesting too. To be honest, I don't know anything about finance. Maybe you can do a different risk assessment about. I think finance, and if I'm curious to know, it's more about like security of preventing theft. Is that am I understanding that correctly? Like how?
Yeah, there are several type of hazards in the insurance field, like you said that physical hazard and moral hazard. There are two type of different in basically in the insurance field. That the
Right.
physical hazard is including that the like you said the cyclone, flood, fire, and the malicious act and the riot that presently in Sri Lanka, and
Right.
those kind of physical hazard. And the moral hazard is happen actually when we it is that we get the information from the customers and insurers, and they are we get the information as the that moral hazard of that
Right.
customer. Some
Right.
give that claim very fraudulently. So we
Mm.
got informations and we get identify those customers.
Mhm.
So that is a different path for get that risk.
Mhm.
So that medical field, it's now I understood lots of about regarding the assessment of the social care.
Anna, right.
So
Mostly our main focus and goal is how you can how you can prevent harm for your patients, for yourself, and for all the people who are working under the healthcare sector. It's all about your life and health. You understand?
yes,
Everything is about your.
yes,
And I think if I'm not wrong, in a moral risk assessment in your finance sector, I think like sometimes people can hack into a database, right, to get
yeah, yeah,
money fraud can happen. So I think maybe the CEO of the company or the manager of the company can sort of think ahead. Okay, how can you prevent something like this happening in the future? Security
yes,
is so that's
yeah,
right. And I think Sanjiva, that can happen in a healthcare sector too. Like for example, if a pharmaceutical company that is really flourishing up, my humans are not everybody's honest, not everybody follows ethics and morals. So that can happen even in a healthcare sector, right? It can happen in a pharmaceutical company, a company that is real, because they say pharmaceutical companies are like another mafia because they earn so much, but at the same time how many medical supplies that they sell is also like not really the best. Eventually that poison. That's why we always, as a healthcare sector, we always say prevention is better than cure. We always try to
yeah,
say, try to prevent yourself getting the disease, because the drugs that you toxicate a person to get the treatment is also toxic. Eventually people die because of the treatment also. So,
yeah,
so pharmaceutical company can also have a what do you call a moral risk assessment where people can breach in to get the money. A theft can happen. So yeah, that also can happen as a risk assessment in the healthcare also. But we don't go in detail. We go more detail about how you prevent a hazard and harm to the
oh,
people, to the patients, to the people who work also. That is what we
yes,
mostly focus. So yeah, thank you
yeah,
for that. Thank you. I'm also getting informed about your side, so that's good. And yeah, who needs to carry out those actions? Like I said before, the first question I asked, can everybody carry out a risk assessment? No, everybody will be, only a specialized person can carry out a risk assessment, a doctor, a nurse, like that. Okay. And when the action needs to be taken by, I told certain things, if somebody is having a heart attack or a electrocuted shock, you can't, it's okay, that person will be okay, he has time. No, you have to act fast, you have to act very promptly. So different situations, how immediate you need to act is very important. And the fourth one is deciding on control method. So wherever possible, you need to eliminate the risk is always the best option. So see, it's just like, don't wait for the damage to happen. Like mostly, again, if I come to Sri Lanka, we all saw from 2020 where Sri Lanka was heading. We all knew that we are going to come into this situation. But people started the Aragalia only when the middle class, the rich, the poor, everybody got affected by the power cuts, everybody got affected by the fuel crisis. That's why it's actually very sad. As a Sri Lankan, because right now, and most of my students know I'm in Bangkok now. Like now, I see it's an Asian country, and in this country, in Bangkok, people don't wait for the mistake to happen. People don't wait for the issue to happen. They are very fast to act. So in Sri Lanka, the people are very selfish. Even the rich came out of the homes to fight is because they got affected. Otherwise, today this issue will be only an issue of the poor or the middle class. But because the rich is also affected by the fuel, because the rich is also affected by the gas, because the rich is also affected by the shortage of medical supply, you see the whole nation outside the country fighting for their country. So that is very sad. We wait right till the end for the issue or the mistake to happen. Only then we act, and by then it's already too late. So that is why even healthcare sector, we say don't wait for the thing to happen. Try as much as possible to prevent it before it happens. It's just like the disease also. Don't wait for the cholesterol or diabetic or hypertension to come for you to start eating healthy, to start working out, to start, following healthy lifestyle. No. Follow the lifestyle right from the beginning so that you will mitigate or you prevent yourself getting into that mess. So that is what you need to have control methods. Always eliminating is best option, right? The prevention is better than the cure, right? So, and another thing is like if you are in danger, if you saw the slippery road and if you actually got yourself into that damage, be selfless to always, tell the other people around there is a hazard, there is a danger that is taking place here. Be careful, don't go. This is a problem, or you immediately inform the manager or the boss. This is this is going to cause a problem to the people in the company. We need to do something. We need to really act fast. That is how a nation gets developed. You need to act fast. You need to think fast. You don't just wait. And as Sri Lanka is a nation, like we love to blame other people. We don't see what we can do as an individual. I think if as one individual can take an action to bring, then that's how the next individual will learn from the previous individual. So I learned a lot by coming to another country how mindsets work. So that is one of the reasons for me also for lecture. I don't want to just make slides and read and then go because I don't believe in that. I believe interactive sessions are important, and I'm always open for your criticisms, your feedback. That's the way I can learn as a lecturer. You have to be open-minded. So that is very important. I think you all must be learning from your other lecturers about effective communication, right? How you talk, how you act, how you interact. So those are very important. When you come to healthcare sector, it's a lot of things, right? The way you communicate, the way you decide, the way you act, how you take decisions, many things come into play, right? So yeah, that is that. And existing controls in a place must be checked to see if they are adequate or compliant with any specific legal requirements or standards. The Health and Safety Executive advises to check control methods and new proposed control methods against best practice. So, another thing that I see when it comes to healthcare sector in Sri Lanka is like you will see 5 or 10 years, there is no development. Still, we are using, paper method to detect patients, take medical records. No, you have to know how to develop. Like you have to bring database, you have to bring digital, because 21st century, everything is a digital era. So, you can't in Sinhala we say Janmata Vada Purudda Lokui. Our mindsets are like that. We just want to be set in the same mindset. We don't want to grow. Nobody wants to change the way. They are just so used to following the old habits. But if you go through that, we will never rise as a nation. We will never go forward as a nation. So we need to have new proposed control methods, bring in new practices, effective practices. That is the only way we can improve the healthcare sector to be more efficient. Is that understood, students? Students? Hello?
Yes, ma'am. Yes.
Yes. Okay. Yes. And then when you're preventing risk to service users, it's important to bear in mind choice. Always consult and ensure you are prioritizing a personal-centered care when selecting control methods. Can you see again? Always you must prioritize a person-centered care. Healthcare sector is all about safety for yourself and for the people that you're serving. So anything that you're bringing, anything that you're proposing, it is always need to be a personal-centered care. Right? And employers in care are required to do all they can to reduce the risk that is reasonably practicable. And this means balancing the level of risk against the cost, time, trouble of control method. So these are the things that you need to really be mindful when you bring in risk assessment. You need to know how much. If this is the lesser the cost, it is better. Lower the time, because time is one of the biggest resources even than money, because time is something gone means gone. You cannot bring it back, right? And trouble of control method, you need to bring this one, that one. No, if you have one proper trained technician, that is really great, right? So you could see when you are trying to control a risk assessment, mainly it is the cost, the time, a trouble of control method. How much you need to, like, you don't need to exert a lot of things to get the job done. You have one technician who is really skilled, and you have hired him for your company when something goes wrong. So that is great, right? And the last one is you record your findings and implement the control methods. Like I said before in the beginning of the class also, everything that needs to be documented. If you have not documented, which means it's like nothing has really happened. So documentation is very, very important. So risk assessment should be shared with appropriate people in your organization. The risk identified along with the control method for them should feed into the person's care plan. And of course, any actions that need to be taken should be carried out. So proper people need to be informed. Your manager, your CEO, maybe if it's like you're working for a doctor or a nurse, they need to be informed, like your superiors or the people related to that task needs to be informed. And even when a decision is being taken, they all need to like take it together, like a board meeting. You have a special meeting, right? In our country, we have many meetings, but no action. So that is one thing. Just as much as you are informed, just as much as you have meetings, you need to also have an action that is executed. So you need to see that, like, actually whatever the meetings that were held the next month or next 2 months, you can see that meeting was useful because now an action has actually been implemented, and now that risk is mitigated, and now no longer that risk is there. So it's very important, right? Okay. And last one is review and update the risk assessment if needed. So risk assessment in health and social care need to have a built review data. You always need to review. Like, for example, let's say last month you bought a new method to reduce it. This month you bought another method to reduce the risk. So you can sort of review it. Okay, last time this method, because of this method, this amount of dangers it didn't happen and it was mitigated. This month, a new method was introduced, and because this method seems more efficient, you need to always have a comparison. It's just like, how to say, between, using a Nokia phone and using an iPhone, you sort of compare. Before you buy, you just see, okay, which is better. Now, of course, now Nokia was like very long time ago, like, or an Android, basically now Android and iPhone. So you just sort of compare and see which is more useful. That is a normal nature of human. We tend to compare in the right way, right? Not for skin color, not for height, weight, and religion or ethnicity. No, you compare for quality and quantity. Comparison needs to, especially in healthcare sector, you compare for the right reasons, of right resources and tools, right? Because not discrimination, right? That is also really bad. I think you would have learned about communication and all. You don't discriminate for other things, physical things. No, you don't discriminate. I'm saying comparison in terms of quality and quantity, right? These two factors. Okay. Okay, so examples of risk assessment in health and social care. In its simplest form, a risk assessment can sit on a spreadsheet or table based on the steps above, right? So, like the first thing, like what is the risk and to whom? Like, for example, let's say, if I can give an example, how can I say, what is the risk to whom? Rather than getting fire and COVID, let's say dengue, I said, Okay. India, I think I also said this last week, like, a very toxic chemical got mixed with the water and a lot of people died because of drinking water. This is there in India, a lot of, they don't follow a very hygienic regime. And so a lot of people die through this situation. So for example, let's say a war is going in the Ukraine, okay, Ukraine-Russian war, let's take that example. So like the pregnant mothers who are now stranded in the Ukraine, right? They are at risk. Why? Because they are unable to go out of the country and they are carrying another human, right? So they are at risk for their life and the child that they're carrying, right? Of a war. Next one, how likely is harm to occur and what is the severity of the harm? So of course, Russian tanks, a bomb is going to burst, so the child can die that the mother is carrying and the mother can die also, right? And then control measures, actions required. So what can we do? What can the Ukraine government do, right? They can, okay, now, in Ukraine, the law is if you are the age between 18 or someone and a man or a male, they need to join the war. But can they do that to the pregnant women? No, because they're a vulnerable type of population of group. Usually any war in the past, they always excluded pregnant mothers, women, and also the children. These are the three people they always excluded in a war zone, right? So the control measures that can be brought by the government of Ukraine is, okay, any pregnant mother, we need to evacuate them. We need to send them out of Ukraine to a safer, close by country. Say, you can say Poland, okay, or Georgia, or you can say Belarus, right? You send those pregnant mother. That is a control measure, right? And then further ongoing actions required, so if the mother delivers a child the next hour or the next month, the government should take, responsibility to provide financially for the mothers, because she's carrying another child for that mother to have resources to feed that child so that she will have shelter, the baby will have shelter, that the child will have, further onwards, safety and security there onwards. And the risk assessment should include, now, for example, name of the person that carried out the assessment. So who is carrying out? So maybe a healthcare sector person was involved in charge for all pregnant women who are in the Ukraine, right? So they need to know who carried out. They need to sign. If I carried out, I need to sign my name, right? And location of assessment, so that they were carried out in a city of Ukraine, say some city, and date, right? And then signature. So this is actually, these four criterias are very, very, very important. So like when I was working at National Hospital for clinical trial, every patient that came to me, I had to sign and I have to write, I carried out, when a patient comes, I need to write a thing called ICF, informed consent form. I have to sign once a patient is giving me the permission to participate in a clinical trial. I have to write a form saying I am Afrida Mohideen and I have taken this patient name. And usually we don't write the patient name because it's unethical. We put a patient number 1902105 like that only, and then the patient visited on this particular date. The patient had these particular symptoms, patient was giving consent to participate for this clinical trial, and I have to write the date, the venue, and I have to put the date and signature, which is a must. And if my auditor comes and checks the things I've written, and if I have not put my sign and the signature, actually the auditor will go and tell my boss. That can come as a black mark to me. So many people who worked on a clinical trial, we are very, very, very careful that we write our name and we write our date. Because one reason, can you give me what is the reason it is important to write the name and the signature? Can you give an example why it is so important to put the date, location, and signature? What is the important thing?
Who is responsible for that matter?
Very good. Yeah, like I think I'll remember last time, like one of my colleagues, she actually put the wrong information in the database. Actually, she didn't put the wrong information. She put fake information. She put false information to save herself. And she put it in the database and she deleted it from the database. But she didn't know that the database, even after you delete it, gets recorded. So we were monitored by the sponsors in Australia. So they found out that she actually put false information. So what happened was they understood that she was doing something wrong, and to cross check, they asked to send the patient's clinic note also to double check. And she later understood that she got caught, and she started to forge the clinic notes of the patient also, which is completely unethical. Okay, completely unethical. And yeah, she was actually in a lot of danger, and luckily I had to work with her. But because each one of us have our own database, her name was the one that got recorded. Otherwise, imagine I was the one who would have been in that trouble. So ultimately, the sponsor had to tell our boss, and the boss had to talk to her, and like a lot of issues and a lot of drama. Okay, so that is one of the reason. Each one had to always put the name and the signature, so that I will not. So because I was lucky, because the database captured her name and her signature, so she was the one who was actually on fault, and they realized it was her, not me. So this is one of the important thing when it comes to healthcare sector in writing information and sign and the date. And the date is also very important, right? They get to know, okay, this particular date, so this date is the one it happened. It could be a month, it could be a year. Very important, right? Even especially when you want to find a thief, the date is first thing. When the policeman comes, first thing is මොන වෙලාවද, what time, what location, කොහෙද මේක වුනේ, මොන වෙලාවටද, මොන වගේ දවසකද, because that is a big information to track down a criminal. Of course, Sri Lanka, you can't even find the criminal because even the police sector is like that. But I'm just saying, if you are doing the job properly, this information is very vital, right? It can happen if it's done accurately, it is very, very useful, right? So anything in healthcare sector is, my advice is, be honest, be ethical, be moral. You should always have your self-conscious. You need to do the right thing. You have to do with a lot of integrity. So integrity is a must. Like even if nobody is watching you, you need to do the right thing, because you never know that when you are going to get into trouble. So like my colleague, I was not aware, the boss was not aware. She has done it because she wanted to save herself, but she got caught eventually. So if she had done the right thing, even when nobody was watching, she wouldn't have been in that situation. So that's one of the reasons I actually left clinical trials, because for me, I felt that this is not a correct field, because it's not, Sri Lanka is not doing it properly, and it is a very risky thing. Because imagine, like, you're putting a patient to a risk, you can go eventually to the courts because you are putting a patient's life at risk, So it's very, that's why I'm saying healthcare sector, you have to do it very mindfully. End of the day, you are responsible for that patient, to that life, to that person's life, right? So it's very important. Yeah, and date of the next review is also very important. So example of common risk areas in a health and social care, the areas that feature most commonly in health and social care risk assessment include moving and handling, like I told you, when you move, you need to know, is there anything hazardous in your moving area? Are you handling toxic chemicals? Are you handling corrosive chemicals? Are you handling carcinogenic chemicals? That is one thing, moving and handling. Medication handling, so like, I told you, if a nurse is handling with a medical thing before giving it to a patient, she should be mindful about wearing gloves. Those are very important things. And if she's actually injecting or taking a blood, she should be mindful about, wearing gloves. So medication handling is very important. That is a common risk. And also another thing is, you need to see the expiry date before giving it to the patient, especially when it comes to like antibiotics, syrups, anything fluid that is like given as infusion. You need to know what are the risks. Is it expired? There is a way to prepare, right? And of course, slips and trips, especially in a lab, if there are a lot of, Kong sulfuric acid and Kong what do you call hydrochloric acid, if the flow is slippery, and if you have to carry these toxic chemicals, imagine, you fall accidentally, imagine it can have like, you can get yourself into a lot of danger. Those chemicals can, literally bring you third, fourth skin burns, So that's very important. And challenging behavior, violence or aggression. This is also a very important thing, right? I like healthcare management is not just physical, it's a lot of emotional investment also. Like I said, doctors and nurses and everybody who is working in the healthcare sector really under stress, really under pressure. It is not a job like you can, just listen to music, go and watch a movie and do. No, you have to have like 110% of focus and attention, right? And sometimes, because of the stress, lack of sleep, lack of food. Like when I was in clinical trials, when I go at 6:30 in the morning, I come back at 6:30 afternoon. Some days no breakfast, no lunch. Dinner is like my breakfast and lunch, like everything at dinner. And it is really unhealthy. No time to even go for washroom. It was another life story of, working as a clinical trial. It's a very stressful job. And even after coming home, patients call me like asking when should I take the drugs, how should I take the drugs, I'm having like this kind of side effects, so I have to like talk to them. So it's a very stressful job, but at the same time you need to be very patient, very calm, very understanding, very empathetic with them, and you can't be like violent or aggressive. So those are all these things are just not in healthcare sector, in any corporate sector or any school or lab or anywhere. It is a thing that you need to follow, right? Food risk. I told you also, like you need to, anybody, not just in the healthcare sector, if you're consuming something, it's the common right practices to see the label before you eat the food, because sometimes maybe nobody knows that they're allergic to peanuts or for seafood or for eggs. Different people are allergic to different kinds of things. So sometimes people don't know until they have that food. So, but if some people are aware of food allergies, they can, usually you can do an allergic test. Usually people can do. And the doctor can say, okay, you are allergic to these kind of food. So if they know that they're allergic to peanuts or seafood, they can always read the label of the food item before they consume. And when they know, okay, this food contains peanuts, this food contains this kind of allergens, so they will sort of refrain themselves from eating that. So these are, another thing is like choking. Sometimes, they say don't talk while eating, and so you can get yourself choked. Sometimes children choke by swallowing like the wrong thing. They don't know, like sometimes a colorful thing they think it's edible, so they tend to eat it. And how you can get burns, like like a student, I think from Visaka, like I think 6-7 years ago, because of not wearing the proper what do you call, the eye goggles in the lab, that child lost her eyesight because of a acid splash in the eye. So these are the common things that can happen in any, not just in a hospital, not just in a lab, anywhere. But you need to know that these are the risks that can happen to a person. So if that happens, how fast you act, how fast the person around you is going to help to mitigate this risk. Okay. And yeah, infection prevention, like COVID-19, before the pandemic, people are very new. What is this COVID? How is it spreading? What can we do? There was a time even when they knew what to do, people were not, behaving and following the rules and regulations. So they have to, implement more strict rules, So these are the risks in a social care sector. We have many pandemics over the past history, the Spanish flu, swine flu, mad cow, but unfortunately COVID is, still in the era, different to all the other pandemics. But, these are the common risks, right? And how we can mitigate them. And in specific environments such as for risk assessment in care homes, the following are also common. You can have burning, like, through heat apparatus. Like, in Sri Lanka 5 or 4 months ago, there were a lot of, gas explosion because of the wrong chemicals being mixed, right? So that can happen in household. And electricals, asbestos, fire, those are the things that can take place. Yeah. So yeah, those are the common risks in a health and social care, not just health, but in social care, which is why we go into like other workplaces or other household. Students, any questions so far? You're almost it's 6:30 in Bangkok, and I think what time is it? Yeah, 5:30, right? 5:30. Yeah, 5:30 in Sri Lanka. So we have around 5 minutes for any question and question session. Anyone can ask anything now. It's up to y'all. We have 5 minutes to discuss anything that you all don't know. I wanted to have a Kahoot today, but I think next week for sure we will have the Kahoot because last week we had only 5 students. So I just was a bit concerned. And I know most of you all, though you all say you all will watch the recording, none of you all do. And because today's continuation, so I was able to recap. Any questions? Sanjeeva, Fayaz, Taranga, Tilani, anyone? Anyone can ask. Is it clear? Student, the lesson, is it clear for you all today?
Yes, madam.
Clear, miss.
Okay.
Yes, ma'am.
Anything that you all would like to ask me, which you all feel a little bit not sure, not clear? Sanjeeva, do you have any question? Because you're new and you have any questions that you like to ask?
No, actually, I'm not still studying now, so.
Okay. So, did you join the morning and afternoon session as well for today's session, morning and afternoon?
No, madam. Morning I couldn't. So.
Okay. No problem. Anyone else? Tilani, do you have any questions? Taranga, any questions?
No, miss.
Okay.
Do we have Kahoot today?
Almost.
No, miss.
Yeah.
Today I can't join, that's why.
Yeah, today anyway, I think we don't have the time because it's already now time is up actually for me to stop the session. So if you all don't have any questions, actually we can end the session. We can just take another 1 or 2 minutes. If you all have any questions, anything that you all didn't understand, students, you all can ask. I think next week, I think last week was I wanted to show you all some videos, but because today newcomers came, I took some time to recap. So next week we'll start off with the video and maybe we'll start with the Kahoot. Fayaz, actually, most of you all wanted to know the answer, right, for the Kahoot question, which I did 2 weeks ago. So I have done the discussion of the answer as well. So go through the recording so you all will know the exact answer.
Sure, I'll do that.
Yeah. So students, I think you all should now get ready for your for the assessment, right? You all are having an assessment. So these are your references where you can read more about the topic that I'm discussing for you all, right? So when you all write the assessment, I just want to ask Taranga, what is the reference style that you all are following? Like, is it Harvard, APA, Vancouver? Do you all know? Like, usually in assignments, we have in-text and in-text reference. So do you all know how you all will be? This I need to be a bit, I'm also not sure what is the reference style that you all need to follow. Do you all know that yet? No.
No, madam, no idea.
Sanjeeva, like in your degree, have you done assignments based on in-text reference, in-text reference? Have you done this before?
Yeah.
Right.
Miss, there are some sites, no, like PDF drive net like that.
Yeah, that is sites to that. Those are your resources to give you help to write the assignments, Taranga. But you need to have a software where they check plagiarism, like we have softwares for checking plagiarism, and also you need to follow referencing, like in-text reference, in-text reference. Otherwise, people can just copy paste an answer for the question, and they can submit. That is not the correct way. A UK program, usually when you are given an assignment, you need to like read on your own, and you need to paraphrase the writing. You need to put in-text reference. You need to put in-text reference. You need to check your plagiarism, whether you have directly copy pasted it. We usually do Turnitin. So I don't know. I'm not sure. I'm not sure whether you all have the exposure and the background to this, because I need to talk to Rishad about it, and then I have to ask him as well, because if y'all don't know, then I need to explain y'all how to do that, So I don't know still how OTHM is going to assess y'all.
No,
you
miss, you have to explain it. We are very new to this, no?
Yeah, that's right. Because what I was told by Rishad is that you all will do the assessment and I will have to mark it. So if that's so, then I don't know how the assessment style is. So I will talk to him, and maybe next week, if so, then we can have like a workshop, how to do in-text reference, how to do in-text reference. There are a lot of softwares to use. So don't worry about it. But I really request all of y'all to, like, have your slides organized methodically. You all have 3 lecturers. So 3 of us are doing 3 different topics. So have 3 folders and, assign them as per the date. So, today is my 5th lecture for this in healthcare profession. So like that, categorize every lecture as per the date order and also go through the references for those topics. So it's very important, because a slide is, because all of y'all are adults, so don't get like used to getting the answer from the lecturer. Y'all are not in high school, y'all are not ordinary level students, y'all are now students learning in a diploma level. Of course, I'm there to help and assist y'all, but I cannot spoon feed y'all. I'm always there to assist and help. Of course, I will guide y'all with something completely new, but y'all also need to be like active learners, go through the references, read. If y'all cannot understand it, y'all can always talk to me. Okay, so I'm there always open for any questions. So just have an idea to go through the references, and let's next week start with the videos and the Kahoot. And please, I'm really requesting, try to participate for the lectures. I understand Sundays are at a stage you all have lectures. It was not my idea, but I understand they all have whole day lectures. But because it's just one day, try your level best to participate. Unless it's a really like work matter, health matter, personal matter extremely, then it's understandable. And even if you all miss it, try to just watch the recording so that next week lecture you all know what is happening, right? So yeah, so thank you all for joining the class. Do you all have any questions? If not, I will end the session because I think time's already up. Students, you all are okay?
Yes, I don't have any problem.
Okay, so because okay, since we don't have any more questions, I will see you all next week, and we will continue from here, and we will have the quiz. So please participate next week. See you guys then. See you all. Have a nice Sunday and a week ahead.
Thank you.
Thank you,
ma'am.
ma'am.
You too.
Bye.
Thank you, ma'am.
Bye.